The Surgeon General sounding the alarm about young people's mental health, and this week put out a public advisory about an uptick in anxiety, depression, and ER visits. So we're talking with an expert on mental health. Dr. Mauseth is part of the strike team on behavioral health at the DOH. So good morning. Thank you for joining us. We have so many questions for you.
Good morning. Thank you for having me.
Okay, first question. We're getting close to 2 years, this whole pandemic thing. So what are you seeing when it comes to kids' mental health?
Well, we've seen certainly a lot of ups and downs. And when you think about how challenging this whole thing has been for adults, we've seen a little bit of an exacerbation. It's been a little worse for a lot of youth and teens in our state, kind of throughout this whole process. So in recent months, particularly, we've seen some pretty significant and in some cases a little bit alarming increases around things like hospital bed, acuity usage in terms of behavioral health needs, and emergency department visits in our state.
And this report said that girls' suicide attempts have gone up 51%, but only 4% for boys. So why is there such a big gap here?
Well, there are a lot of sort of socio and cultural differences that can influence those numbers a little bit. Some of it may be around the likelihood of talking about it or seeking help related to behavioral health conditions, whether that's around depression or anxiety. Sometimes it's a little bit more comfortable for young girls to sort of talk about those things with their family members. And again, considering, this is a nationwide issue. This is not something that's specific in Washington state. So the familiarity that people have in sort of discussing these issues varies dramatically across states as well.
And kind of talking about that, what are some warning signs that people should look out for, and how should we approach a young person who might be struggling?
Yeah, you really want to consider abrupt changes in behavior. So it's really normal for all of us to have a bad day. We start the morning out really well, and then by the time we get to lunch, it feels like a bit of a struggle or a lot of a struggle. And so that's the same for youth and teenagers as well. There's a lot of ups and downs. But what you want to look for are consistent behavior changes that last somewhere in the neighborhood of around 2 weeks or more. And also what you want to pay attention to are really a lack of interest in things that used to be exciting for them. So maybe they used to be very social and engaged, and they're really withdrawing and not participating in things right now, even though they could. So looking for those big behavior changes, and loved ones and caregivers and parents and close friends are the ones who know the most about what those baseline behaviors are to recognize when something's different.
Should there be any kind of, preventative talk that parents should have with their kids, saying, if you can come to me, if you're just not mentally there on a day, or explain to him, what it might look like if they're not having a good day?
Yeah, great question. And the answer is basically, yeah, it never hurts for people to reach out. It doesn't hurt to ask about behavioral health conditions. It doesn't increase risk. And in fact, does increase the likelihood that any youth or teen is likely to feel comfortable sort of coming to an adult and talking about what's going on. So being available and making time when sometimes the windows when kids like to talk are inconvenient for adults. And it's really important that we do try to make ourselves as available when they're ready to talk as much as possible.
All right, Dr. Mauseth, thank you so much for joining us this morning. I know you've definitely helped some parents today who are watching this right now.
My pleasure, for sure. Thank you for having me.